So one of the first questions that we get from parents who want to bring their child to therapy is, what's actually going to happen? How does therapy work with children? And it's a really good question because a lot of psychologists tend to operate similarly, but sometimes there's some differences as well. We always, at Life Resolutions Morley, we always begin with what we call a parent intake session. And that's a session that we have with one parent, or ideally both parents, but not the child. And that's where we find out about the child and what the difficulties are that they're having and that you want us to help them with. In that session, we also need to really try and understand what's going on for the child in a broader sense of the word and what their life's been like. So whether they're 4 or whether they're 10, they've lived life and they've had life experiences, and it's important for us to know about those. It's also really important for us to know things like their temperament and what they struggle with, what they find easy, and the nature of their relationships with their family, because family is important for all of us, but it's particularly critical, of course, for children. So we need to understand who's who in the zoo, what their siblings do and what they're like, and parents and routines and all those kinds of things. And it's really important that that first session happen without the child present, so that parents feel really free to talk very frankly with us, so that we know what's going on. And once we've had that session, we'll talk with the parent about how therapy is likely to unfold from that point. Because depending on the age of the child and depending on the issue that they're being brought for and their life experience, we may have a number of sessions with the child on their own. We might have sessions with the child and the parent together. And, we need to, I guess, have a bit of a treatment plan about how we're going to help this child overcome the problem. And so that's something that we talk about in that parent intake session as well. And then from there, we start to schedule those sessions. But we are really big believers that parents are the most effective at helping their children. So one of the things we really want to do is we want to help parents help their children as well, which means that we're not a practice that is going to exclude parents entirely from the process. The older children do get, particularly our adolescents, our teenagers, the less parents may be involved, and that's because teenagers do need quite a fair degree of privacy for them to feel as though they're going to open up. The last thing they're going to do is tell us everything that they need to talk about if they think we're going to run away and tell their parents everything as well. But the younger they are, then the more we definitely include parents in that, in the therapeutic process. And we always give feedback, and we certainly want to be talking to parents about how they can help their children in the home. But it's just occurred to me as I'm talking that the issue of confidentiality with children also tends to come up. And as I said before, anyone needs to feel a degree of privacy for them to be able to share their innermost worries and struggles. So we need to have this really fine balance between offering children privacy, but also understanding that they are children and there are some things we need to talk to their parents about. And so we talk with both parents and children about how we share information. And ideally, we always work to share information with the child, either doing it on their own outside of therapy, or with the child perhaps telling their parents something in the therapeutic room with our support, or maybe we do it with the child there. We really try and encourage the relationship between them and their parent. We don't want to interfere with that. If anything, we want to enhance it if possible. And so that's a fine dance that we always play when we're working with children and privacy and confidentiality. But ultimately, if we have any concerns, just like with any other client, we definitely share those with parents and we get them on board in terms of helping their child through that particular struggle.